Hello. During the next few minutes, we're going to explore various aspects of third molar or wisdom tooth surgery. The purpose of this video is to help you understand a method of treatment that may be right for you. And because no procedure is without possible risk or complication, we'll inform you of the potential risks or complications associated with your treatment. Let's begin by reviewing some questions that many patients ask. Then we'll provide the answers and explain your treatment options. True or false? A third molar or wisdom tooth usually becomes impacted because there's inadequate room in the mouth for it to erupt properly. Impacted teeth must always be removed. Is this true or false? True or false? Surgical removal of impacted third molars can sometimes be scheduled at the patient's convenience. Is the following statement true or false? A risk associated with this surgery is damage to the sensory nerve in the lower jaw. These questions are related to the diagnosis, treatments, alternative treatments, and risks of this surgery, the major areas of discussion in this video. Now, let's explore these areas in more detail.
Third molars, or wisdom teeth, develop and grow in the very back part of both the upper and lower jaws. These teeth are scheduled to enter the mouth at about age 18, the so-called age of wisdom. A high percentage of wisdom teeth become impacted, meaning they can't reach their expected position. When this happens, wisdom teeth most often become angled or turned in directions that may cause damage to adjacent teeth or parts of the jaw. When examining patients, we determine the position of the wisdom teeth and check the bite and jaw joints. In order to develop an appropriate method of treatment, an X-ray is included as part of the diagnostic procedure. Sometimes, the X-ray films reveal that the impacted teeth can be left in place with only a small risk of future trouble. However, in many cases, removal is the preferred course of treatment. For impacted third molars, there are basically only two forms of treatment: surgical removal, or leaving the teeth in place and monitoring them. When consulting with patients, we review the possible complications of leaving impacted wisdom teeth in place. These risks can include infection, as well as recurrent pain and swelling. Additional risks include cyst formation, with resulting destruction of the surrounding bone, the formation of tumors, as well as decay of the third molars and adjacent teeth, and the shifting of other teeth, causing bite problems. We review all findings with the patient to develop a mutually acceptable treatment plan.
Now, let's look at the most common treatment of impacted third molars.
See, I got a pretty busy schedule with work and school and everything. So when my oral surgeon said the words impacted wisdom teeth, I was afraid that I'd have to take off a lot of time right then for the surgery. But I was really relieved when he said that I could just plan the surgery around my final exams and my work schedule.
If there is no obvious pain, discomfort, or damage to adjacent teeth or tissues, most third molar surgery can be scheduled at the patient's convenience. When patients are preparing for surgery, we can often present them with several choices of anesthesia that can make the removal of wisdom teeth quite tolerable. Well, in cases where the X-ray films reveal that the impacted teeth would be uncomplicated to remove, or in patients whose anxiety level is low, we may recommend a local anesthetic.
Like the Novocaine they use when you have a filling?
Well, Novocaine is one form of local anesthetic, yes. They all produce similar results. That is, they numb the general area of the surgical site. The usual side effect of local anesthetic is a few hours of numbness following surgery.
So that's what you'd recommend for me then?
Well, in your case, due to the degree of impaction, you might wish to consider a light sedation, so you'll be relaxed and only minimally aware during the procedure. The usual side effect of local anesthesia is a few hours of numbness following surgery. Side effects of light sedation and general anesthesia can include disorientation, prolonged drowsiness, nausea, vomiting, and, in a small percentage of cases, allergic reactions to the medications, and irritation of the vein where the IV unit has been placed, called phlebitis. And, as with any general anesthetic, whether performed in a hospital or an outpatient setting, it may be potentially fatal. If light sedation or general anesthesia is to be used, the patient may not eat or drink for at least 6 hours prior to surgery to prevent nausea and vomiting during the procedure. In addition, the patient must be accompanied to the surgery and driven home by a responsible adult. The patient may not operate a vehicle or machinery for 24 hours following surgery. During the typical removal of wisdom teeth, the oral surgeon makes an incision in the gum overlying the third molar or wisdom tooth, allowing it to be exposed. Occasionally, a small amount of the thin jawbone that covers the impacted tooth must be removed to complete the exposure. When the tooth is clearly exposed, we remove it in 2 or more pieces. After removing the tooth, we rinse and examine the area and then usually place 1 or more stitches. After surgery, patients are allowed to rest until we feel they are ready to be released. The patient will receive written instructions for home care and will usually be asked to return for a follow-up within a few days. Now, some side effects can be anticipated following the surgery. Now, these can include bleeding for a few hours, swelling, discomfort, muscle stiffness in the jaw area, and temporary bruising of the face and beneath the sides of the jaw. Risks also include soreness or cracking at the corners of the mouth. The patient's post-operative instructions list ways to deal with these occurrences. Now, these can include ice packs for the swelling, pain medications for the discomfort, and methods to control the bleeding. If patients experience extreme discomfort, excessive bleeding, or have questions, they should call for additional consultation and direction.
So far, we've reviewed diagnosis, treatment, and alternative treatments. As with all surgical procedures, there are also known risks and complications. Your oral surgeon will explain these risks to you prior to surgery. If you have questions or need further explanation, always be sure to ask.
Well, first, there's the risk of infection. In any surgery, bacteria are always a threat and may cause infection. However, the infections usually respond to antibiotic treatment. In cases of severe infection, prolonged treatment may be necessary.
Are there other complications?
Depending on the difficulty of the surgery, there are a variety of risks. Well, these can include damage to nearby fillings or to the adjacent teeth. There's also something we call a dry socket. This occurs when the blood clot in the site of the surgery or socket is destroyed. The walls of the socket are then exposed, causing a persistent sharp or dull throbbing pain deep in the jaw. And the condition can be treated to relieve the pain. However, the area is often slow to heal and usually requires a number of post-operative visits. Do you have any questions?
Nothing right now.
A complication associated with surgery in the lower jaw is the possibility of nerve damage. The surgical site is usually very close to the sensory nerve that runs through a canal in the jawbone. Now, sometimes this nerve is injured during lower jaw surgery, leaving patients with a tingling or a numb sensation in their lip, chin, gums, teeth, or tongue. This sensation, which is similar to the effect of Novocaine, can last for days, weeks, or months. In rare cases, the condition is permanent. Surgery in the upper jaw also bears the risk of complication, since the surgical site usually involves the sinus cavity. This may lead to a sinus complication that requires additional treatment, usually with antibiotics. In jaws that are thin or small, there is the possibility of fracturing the area adjacent to the extraction site. At all times, patients are encouraged to ask questions and request additional information. Our primary goal is your health and well-being, and we're willing to do whatever it takes to make you feel comfortable and informed about your care and treatment. I want you to read this, make sure you understand each paragraph. Informing patients of the risks associated with surgery allows them to make decisions about their treatment and have realistic expectations about the results.
Before we close, let's take a few moments to review the questions posed earlier. A risk associated with this surgery is damage to the sensory nerve in the lower jaw. An impacted tooth does not always have to be removed. In some cases, impacted teeth may be left in place with little risk of future problems. This is a matter of professional judgment that you and your doctor should fully discuss. It's true that a third molar or wisdom tooth usually becomes impacted because there's inadequate room in the mouth for it to erupt properly. True, surgical removal of impacted third molars can sometimes be scheduled at the patient's convenience. Please consult with your oral surgeon if you'd like further explanation on any of the information in this video, or if you have questions about topics that may not have been included. During the informed consent process, you'll be asked to read and sign a surgical consent form for the procedure just described. Your oral surgeon is committed to not only caring for your physical needs, but also providing all the information you need to make an informed decision about your course of treatment.